when the people watch your show, I want you to pay a lot of attention to the questions that you ask. I was totally amazed, again, which I'll talk about that later, how you are able to diagnose a pain like with Leah on the famous, we call this the 27 steps to recovery.
Right.
He's got it down to, after he takes you out of the serum, gives you a shot, you have 27 steps to create that pain. And no one has ever done it yet.
No.
They either go like, oh, God, I feel, Doc, why'd you do? And that happened with Leah. Referred pain. Did I get that right?
Yeah.
She had referred pain that was causing her problems with the ankle.
Down the foot. Down to the ankle.
Explain what referred pain is, because, we have new listeners every day.
Pain in various places is caused by other places. So it takes a long time to learn these pain patterns. See, over
60 years with you.
So all the little parts of the back, each one causes a pain pattern. And you have to know about this and how to find it. So that's why an MRI is not that good.
Because it doesn't show where the pain is.
It doesn't tell you where the pain actually is. They can read something, but is that where it is? You don't know that. You have to do it by examination. Then you have to know if they're correct, what's causing that. And then you have to know what's the secondary cause of that. See, so it's very complicated, and you have to know the anatomy and the physiology. Now, somebody called me this morning.
Already?
Yes. I hope they're listening to this show.
Oh, I hope so, too.
I'm going to talk specifically about this man who has a backache. He had a fusion done, the screws again. Don't do that. People, don't do that. It causes immobility. And what's the exact opposite of what we do? Immobility. We want mobility, and you can't get it when there's screws.
The inability to stretch.
The inability to stretch is what a pain is, and you can't move if there are two screws holding your bones like this. Boom. How are you going to move there?
Right.
So you have an inflammation in there, but you can't get the mobility back. So now you have a pain. Now you're coming in to see me. You're saying, I have all this pain. And I see the screws there. We just happened to, a woman was just...
now we're getting into this step. Now
dropping by and...
Can I explain what happened?
Sure.
Dr. Pannozzo was taking care of a patient. As she was taking care of a patient, I was just talking to this lady, first time I ever met her, and she was telling me about all this pain she has right now. She's having trouble sitting. I said... And she told me that she had surgery. She had 2 rods. Am I right, Nick? She had 2 rods, and then they put a stimulator in her back.
Yeah.
And I said, "How you feel now?" She said, "I'm just so much pain, and it's going to cost me another $7,000 to do it again." So I said, "Why'd you do this? You're here. Talk to Dr. Pannozzo. He don't care. He'll tell you." She spoke to him. She went in. And she got, I don't remember, I was in there, 2 shots, and she was actually teary-eyed because I said, "Is everything okay?" She said, "I don't have any pain."
Yeah, that happens a lot.
I mean, that's amazing.
You have to stay away from the surgery if you can. First of all, a stimulator.
What is that?
Well, it's a wire they put in, and an electrical stimulation. You feel that instead of the pain.
Oh, so it's a mind thing.
But that is a failure of treatment.
Yeah.
So you never want to do that. You never want to burn anything out either. She had nerves burned out.
Oh, I didn't know that part.
Yeah, she had all kinds of things done to her. I mean, these people are just...
I saw the X-ray. They don't know... it's not that they don't know what to do.
They don't know exactly where the pain is from, is what I'm talking about. And if they use MRIs a lot, they're losing right off the bat because you have to find it by examination only. And so this man we're talking about, we'll take that pain right out. I know where it is just by what I was told over the phone.
Would she be... so that the girl that came in, is it difficult for her to get those things out and be treated the right
screws?
way? Yeah.
No, it's not.
I mean, I saw a scar. I did see when I walked in with Nick.
But
I saw the scar tissue.
Can't get anybody to do it.
Oh, really?
Yeah. That's a shame.
So if you keep
I'm gonna develop a clinic in my kitchen. I'll put something down, use my screwdriver and just pull it screws
Well, you
out.
said that. You can take a screwdriver and pull it right. But it's horrendous when I saw that. I said, "Oh my God."
You see, when you treat these things every day and you know where the pain's from, it's rather easy to do it. You can do those things, and they work. Any surgery decreases your percentage of improvement. Try to get the idea. You have to understand what you're doing. You got to know if you're going to improve. Somebody's got to tell you yes or no whether you're going to get better or not. I will guarantee my work. You always get better.
And in fact, you even said to her, if you're still pain, come back and I'll do the other side. You just told her. Well, what amazes, I'm always amazed with you. I mean, I know you're now going on 4 years, and every time I see something that I say, wow, you can't do, you do it. And when you see someone that's teary-eyed, you say, wow, it makes your heart feel bad that you had to go through all that stuff, right? And Nick sees everything because he's there on almost every procedure.
Pain is very emotional.
It's a bitch.
And, you don't know what it's going to do to your body, what it's going to do to your lifespan. And what they tell you is the worst that you can hear. When I talk to you, I tell you where it is. And mainly pain is, you know what a pain actually is? It's a ligament. It's a normal ligament that's overused, causes a pain.
That's what the guy said.
Yes.
In the article. Yeah. Everything you said.
So he agrees with me, huh?
Yeah, I mean.
Who is this?
I went to look at his name.
Brilliant guy.
What I'm saying is he doesn't have his name on the article, which I just went with. And I guess he's either a orthopedic surgeon who realizes that everything you said is true.
Probably not.
Or he's just someone that's observed. See, let me just say one thing to all the new listeners. Dr. Pannozzo is also a medical doctor specializing in musculoskeletal problems. From pain.
Ohio State.
From Ohio State, okay? The big O that owned, I mean, that's the guy I want to see because Urban Meyer is one of my favorite coaches. I like him a lot.
It was every Saturday football game.
That's right. Yeah. And in those days, they didn't play with helmets, right? Going back, how old you are, okay?
You know, they still haven't fixed the helmets so you don't get a neck injury, which is concussion. They call it concussion, but it is not.
Well, what you said is very funny. I saw a show, it was called 30/30, which is something on, I think it was on 1602 on my station, on Uverse. And it showed that they're making ways now of trying to help an athlete from not getting concussions. And they're not doing anything to the head. They're doing everything to the neck region so the neck doesn't snap back.
That's right. Yeah.
And you've been talking about that forever.
This for a long time.
And I know something that's near and dear to your heart, and that's scoliosis. People, please, if you have a child, I mean, I'm a nobody. If you have a child, and I'm very passionate about children, and I'm very passionate about people, before that surgeon says to you, take your kid, and I'm going to put the cage in.
Well, we just had somebody call up the other day. A mother wanted to bring her son.
I don't have to go anymore. Go ahead.
17-year-old son in for scoliosis. And I said, yes, get a referral from your pediatrician or family doctor if you need it. He never showed up because the family doctor would not refer to me. Now, that is really dumb. You know, who does this guy think he is? He's got a practice, and he thinks he's God Almighty. You gotta
think for yourself.
You gotta talk to people instead of referring to a surgeon or physical therapy, which doesn't work. We did the research on scoliosis. We guarantee removal of that.
And if you don't believe or you misjudge.
And so we lost a teenager too, and another one called me up, and 40 years old, had rods in the back. Since they were 15 years old.
Wow.
Can you imagine the pain and discomfort this little girl had? I mean, you can't believe it. Don't do it. You don't need surgery. Absolutely not. You do not. And these pediatricians ought to wise up, you know. They got to talk to people. They get tied to orthopedic surgery from training, and I know that because I trained with them. And they really don't think for themselves on musculoskeletal. So, and their mind's got to open. They've got to say, you know, is it possible to do it? Yes, it is. We can treat those, and you can watch it yourself. I always tell somebody, you don't believe it? Come in with the patient, watch me do it, and you'll see the result. And then what are you going to do? But they don't take me up on it.
You know why they don't take you up, Doc?
I don't know. Why?
Because when you, I know it's stupid to say, but it's true. You have a family doctor that they've known their whole life, and the family doctor can't believe what you're saying is true. And what they don't understand is you're not a chiropractor, you're a physician. You're a medical physician that's gone the 12 years. They don't believe.
Yes, that's not the problem. The problem is they don't inquire. That's the problem.
That's true
They don't call up and say, what can you do for this? And I'll explain it. They don't call up. They don't inquire. I don't know what they think they're doing. They're not saving the patient.
No.
Because we can't do any harm, First thing you do with Hippocratic Oath, do no harm. Yes, we never do anybody any harm.
No.
You either improve or you don't improve, but you can't get worse. There's no way you can get worse. We understand musculoskeletal pain. You understand?
Now, for all of you out there that has a child with scoliosis that might lose a scholarship, the medication that Dr. Pannozzo gives is one of the few that the NFL and the everything approves. It's not on the list because it's not a thing that
most of the people who treat this do not understand this medication.
Right.
They like the powder. There's a powder form and a not a powder form.
Oh, I didn't know that.
We don't use a powder form.
Yeah, why would powder? How do you get the needle in a powder? I never heard of a powdered one. That's
well,
new to me.
it goes in there, and
Right.
The other thing is where do you put it? You got to know where to put it, and so we have no downside to what we do at all. We've treated close to 80,000 people and never had a lawsuit.
No, because it works. And you know what it is? Okay.
You can't hurt anybody. You understand? You can't hurt anybody.